Student Dr. Courtney Remington. This is my coworker.
Yeah, Eugene, student Dr. Eugene.
What's your name?
Manuel Hernandez.
Manuel Hernandez. It's nice to meet you. So we're here to talk about the possibility you were approached about being in a clinical trial. Is that right?
Yeah, Dr. Lin was in, and he's in some kind of research. He's a PI, I'm not sure what that means, private investigator or something, and he's recommending that I try this drug. And I tell you, I've been feeling miserable. I'm willing to try just about anything. Everything when I do eat, I get sick and I throw up. I just want to get back to the way I was before I got sick. I just retired last year, started to enjoy life with my family, and now this all of a sudden. So.
Okay, and it sounds like we've been through a whole host of drugs trying to treat the colon cancer, and we're sort of at the last stage here in trying to find options to treat it. So as far as the PI goes, that's the principal investigator, so he's just in charge of the study, not a private investigator. But Eugene might have some information on the benefits.
So I think to make the best decision for you is to understand what the clinical trial and what this medication can do for you. So these are treatments that are in the first phase of being tested on humans. So it's kind of hard to say what the result might actually be. So that's something you have to consider. So if you undergo the treatment, you can have some side effects, something that is grave side effects, or you can actually have some response in treatment, which would be good for you.
But the important thing is too, because it's a brand new drug, we don't know what those side effects would be in humans at this point. So that's one of the risks that we'd be taking in enrolling you in that study.
I don't even know what a trial means. All I know is old Perry Mason episodes about when I see trials. Is that what we're talking about? And what do you mean by clinical?
Okay, so what we're talking about when we're talking about a trial is when people are developing new medications. They first try them in animals and see if there's any sort of effect on the animals. And then if they think that there could be some benefit, for example, in mice that have cancer, then they start looking at if it would be beneficial in humans. So in phase 1, that's their first time giving the medication to humans to see if it would be beneficial for humans. Later on in what's called phase 2 and phase 3, those are sort of higher level trials in bigger populations and looking at more of the side effects, not just to see if it's effective. Does that make sense?
Well, you're both doctors and you both seem really smart. What do you recommend I do?
Well, the best thing that we can provide for you is answering your questions and concerns. Historically or in the past, all drugs go through this type of process where they're tried on humans to make sure that the drug actually has efficacy in humans. So the main question here is, do you want to take the risk, the kind of jumping into the unknown? And we're here to help you understand that there are risks and there are benefits, and to answer any of the questions that you might have about that process.
And to go off of that, we actually have our team here to help us with that because they've got some different perspectives on answering your questions. So we've got a social worker, we've got a pharmacist who might know a little bit more about the medication involved. We've got an occupational therapist, they might be able to look at another approach to your pain, and then we've also got a nurse. So we're gonna have them come in and we'll have the social worker talk first and see or actually.
Well, what about my family? Can my family be part of this? Learn about this? Because they're awfully concerned and confused, and when they come in, I never can remember what all the doctors and nurses have told me.
If you agree, if you would like us to share that information with them and you give us consent, then we can share that with them. But we have to have your consent in order to do that, just in case there was anything that you didn't want us to share with them. So we'd be more than happy to if that's what you would like for us to do.
Yeah, I mean, they've been suffering a lot from this too. I know my wife is very, she cries a lot, and I just don't know what to tell her.
Okay, well, I think if we get the team in here and we talk a little bit more about a plan, then that might give us some information that we'd be able to share with your wife and your family. So how about, we've got the occupational therapist here, and I think he's maybe got some ideas. We'll kind of just talk with them, with you, and see if we can figure some stuff out, and then we'll bring your family in to discuss some of these options. Does that sound okay?
Yes, yeah, I think so.
Okay. So we've got Dr. Pena over here. He's our occupational therapist. This is Mr. Hernandez.
Hello, Mr. Hernandez. How are you doing?
I'm not very well. My stomach's just always upset. I hate hospitals. I don't sleep at night. Is there something you can do so they'll wake me up in the middle of the night all the time?
So they don't wake you up? Excuse me.
Right. Just when I'm sleeping is when they come in and want to pump me or take my blood pressure or something.
Oh.
Well, we'll talk with the nurses about that on the physician side, but I think Mr. Pena has some options as far as helping with your pain. I know that you haven't been feeling very well and you've been stuck in this bed, so he might have some options for that. So we'll discuss with the nurses about when they're waking up, but we'll talk about options right now for your pain. Does that sound okay?
You mean medicine, other kinds of medicine you try?
No, more exercises that Mr. Pena knows that we could do in conjunction with some of the medications. So I'll let him talk about that.
So basically, I'm just going to talk about you and your life. How has it been? You know, just want to see your point of this.
It's been terrible. I just can't do the things I used to do. We used to walk a lot. We used to go fishing. And now I can't do any of that because I just feel sick all the time.
Yeah. And how does your family feel, like you being sick and everything?
My belly?
No, family.
My family, oh, well, they're worried sick too. They all try to pretend like there's nothing wrong, and they're not worried, but I know they are.
Yeah. I mean, this would be a great time to bring in the social worker also to help me out, you know, maybe spiritually, and you know, do you have anything you want to talk about?
Well, I don't know what a social worker does, so I don't know what questions to ask.
Hello, my name is Irene and I'm the social worker here at
At the hospital now.
the hospital. And I just want to make sure and assist you with some of the decisions of your life with you and your family. You say you have stress and you're worried, and your family does too. Worried about what would happen.
Yeah, definitely. They're very worried, and I think, you know, it's the not knowing. I guess what the doctors are saying is that I'm going to die. You know, this medication is the last chance, I guess, is what they're telling me. Is that right?
So at this point, your cancer has not responded to any of the medications that we've given you. This would be our final treatment option.
We can't know for sure what the response would be, and that's the kind of the process that we have to discuss with you and your family and the team, is whether if you want to take that kind of risk and potentially get better, or there might be some more grave consequences, some side effects.
So our social
Well,
worker.
I don't want my family, at least my wife, included in this decision. It's a lot to take in all at once.
Okay, is she here today?
Well, she's supposed to be coming. Maybe they're stuck in traffic or something. I don't know.
Okay. Well, we'll be sure to talk with her about this. Right now, the social worker, she might be able to help assist us in whether or not making the decision about the clinical trial for this experimental medication would be a good idea, and maybe look at the quality of life that could be obtained or not obtained as a result of participating. So she might be able to help guide us with that.
What do you mean by quality of life? I don't know what.
Planning, if in the case that you no longer are here with us. Like planning with your family, because you say that, your wife is in distress and you are worried about that? You're worried about your family?
Very much.
So as far as the quality of life, like my coworker, Dr. Eugene said, Mr. Pisa said, sorry, you know, taking this medication could result in more side effects. It could make you more ill. It could result in death. Also, not taking the medication could result in death. And so we want to be sure we consider how you're feeling while you're taking the medication, or if you decide not to take the medication. So what sort of activities you'd be able to do, how you'd be able to interact with your family, visit family, if you'd enjoy food, just small details that make you enjoy your life. We want to be sure to maximize those as best as we can. And whether that's with the medication or without the medication, that's something that our team is going to try and help figure out.
Well, I want to know what you all would tell your family member if they were in my place. What would you tell them to do?
I'm not entirely sure, to be honest, Mr. Hernandez. This is a very difficult decision to make. It's not an easy one. It certainly is a case-by-case basis, and it depends on what sort of results they've had in some of the experiments with the mice, what sort of side effects they anticipate, and if there have been any other trials to date on humans with this medication. So it really is a case-by-case situation that I think would be difficult to apply in other situations.
Well, I appreciate your honesty at least. I mean, you don't really know. I guess you're just trying to let me know what my options are.
Yeah, and that's part of what we want to convey to you here is that with these experimental medications, there are so many unknowns, and so we're trying to bring the team in to try and sort through them as best as we can so that you and your family can make the best decision for you and your family. So we also have a pharmacist here that might be able to help us answer some of those questions about the medication. So I'm going to bring her in. This is Ms. Thomas.
Hi, good afternoon, sir. My name is Sharon. I can answer any questions you have about the medication. I don't know too much about the investigational drug itself, but I'd be happy to talk to the PI. You said you've talked to him before. I'd be happy to talk to him and relay that information back to you, maybe explain it to you in a way that you could better understand if you think that would be helpful.
Well, Dr. Lynn talked about every medicine having some bad effects, so I guess you call them side effects. Well, what can I expect with this medicine?
With this one specifically, I don't have that information, and to be honest, I don't think they know either. Part of the process of this trial is so that they can find out what those side effects are going to be. And in the future, if this does get approved as a therapeutic drug, they would know because of the effects that it has on you, perhaps, or on other participants, they would be able to tell what the side effects are in the future. At this point, a lot of it is unknown, as your doctors mentioned. So we're going into this just uncertain about the side effects, but hopeful about possible benefits. But again, we don't know what the benefits are going to be or to what extent.
Well, if it works, when will I probably get better? And if it doesn't work, how long do I have to live?
Those questions are part of the trial. Unfortunately, we can't give a timeline. It's hard to tell what the response would be either way. So I think, is there anything that we can do right now to make you better, or before you can discuss this with your family in more detail? Is there any other questions that we can answer?
Well, other than getting my family involved and trying to reduce their worry, I guess not. I mean, I want to know about the side effects, and I want to know how long I have to take the medicine. And when can we get started if we're going to do it? You know?
So I think what would be good, like Dr. Paseka said, is, we'll definitely get your family involved. As of right now, we will consult with Dr. Lin to try and get some more information on this drug. We've also got a nurse here that's going to help us out. And after she comes to talk with us, we will we'll reevaluate again.
Hello, my name is Denora. I'm a student nurse. And my primary goal today is just to make you feel as comfortable as possible. If you have any pain, just try to minimize it. Depending on your religion, we could bring in a chaplain or a priest or whatever you prefer, just to help you maybe talk it out with him and your family and make them feel better about the situation. Do you have any problems right now? Is there anything I can help you out with?
Can we get them to not turn the lights on in the middle of the night and wake me up while I'm sleeping?
yes, that is, we can help you with that. And I know you said you were having problems with us, coming in the middle of the night. We could just work out a schedule that benefits you and then just make you feel better.
And it seems like when people come in, and this is the first time I've had people together in the same room talking to each other. It seems like most of the time, when one person comes in, they have to talk to the other person. What can we do about that? So that when people talk, my family knows what's going on, and they're saying the same thing.
So that's something that we're trying to work on right now, which is why we have the whole team here to try and discuss these options together and with you. I know that you'd like your family here as well. We want to be sure we communicate with you directly first, and then we can also communicate after that with your family. But after you know that information, you can also help communicate with them so that the team involves you and your family.
Well, that sounds better anyway. These people are listening to me, and they're trying to help my family out.
Yes, definitely. We just want to be sure that we talk with you. If for some reason your family wasn't able to make it in this afternoon, we want to address your concerns as quickly as possible, and then we can bring your family in after we've addressed your concerns.
Do you think I'm gonna be able to get back to doing?
15 minutes is up.
At least taking a walk around the neighborhood and things like that?
It's one. I mean, there isn't really a way to tell what the response to the drug would be. It's a possibility that you could return to those activities and have a better response to the treatment, your cancer treatment. But again, it's really difficult to say, and we can't say either way.
I know that's difficult not to have a direct answer, but unfortunately there are a lot of things that we just don't know. If we can talk with your oncologist, Dr. Lin, we might be able to
Begin
get
your debriefings.
some more
Begin
solid
your
answers
debriefing.
for you, and then we'll be able to hopefully